Tonight, we've also learned that a local hospital was among those chosen to be first to store the vaccine.
News 8's Abby Alford explains what this means and the challenges still ahead when it comes to distribution.
Rady Children's Hospital confirms with News 8 that they will be one of the facilities in California that will be storing the COVID-19 vaccine. This on the same day the CDC decides who will be first in line to get the vaccine. As CDC panels decided healthcare workers and people living in nursing homes will be among the first to get the COVID-19 vaccine, which could be available to 24 million Americans in just 2 weeks.
Obviously, our healthcare workers have got to be at the front of the line, as do our most vulnerable.
The Pfizer vaccine would be delivered by December 15th and needs to be stored in an ultra-low freezer. The first batch of Moderna vaccine could arrive a week later. Both require 2 doses. Rady's announced that the California Department of Public Health asked that the hospital serve as a storage facility until the FDA approves the vaccines. They declined our request for an on-camera interview, but sent a statement saying, "We don't know how much vaccine we will be storing, when it will arrive, or who will receive it first." Infectious disease specialist Dr. Mark Sawyer is on the governor's 11-member COVID-19 task force that scrutinizes any vaccine that will be delivered in California. We spoke to him 2 weeks ago.
I'm very optimistic that the vaccines are going to be here very soon and they are going to be effective.
In January, 87 million essential workers, teachers, police, firefighters, and food workers in transportation will also receive the vaccine. The following phase will include 153 million adults 65 and older and those with high-risk medical conditions.
We'll have to be reassuring, we'll have to be persuasive.
And difficult for local governments, too. San Diego County Chief Health Officer Dr. Wilma Wooten says the biggest challenge is prioritizing the vaccines. She says 75% of San Diego County's population makes up the first 2 phases.
Our vaccine preparations have been going on for months, preparing for multiple possible scenarios and unknowns. Around infrastructure, around data, around distribution.
It could take at least 5 months to roll out the vaccine to all Americans. The county says that there are other providers and hospitals and facilities, including the county, that have applied with the CDC to store the vaccine, but they've not been decided.